What is the presenting problem for an initial therapy consultation? Imagine trying to fix a puzzle without knowing what the picture looks like. That's why understanding the main concern that brings a child and their family to therapy is so important. When families seek help, they usually notice certain signs or behaviors that cause worry or distress. These are called the presenting problems. They can be emotional, behavioral, or developmental issues that interfere with daily life. Parents or caregivers often observe these concerns because children, especially younger ones, might not be able to explain what they are feeling or experiencing. For example, a child might have frequent angry outbursts or seem anxious all the time. They might struggle to manage fears or mood swings. Sometimes, children act out aggressively or withdraw from friends and family. These behaviors can be signs of emotional dysregulation, which means difficulty controlling feelings. Other times, parents notice developmental delays like trouble speaking, understanding instructions, or paying attention. These issues can affect how a child learns and interacts with others. The presenting problem might also include social challenges, such as difficulty making friends or feeling left out. When these signs are persistent and affect a child's life at school or home, they become the focus of therapy. During the initial consultation, the therapist asks parents or guardians detailed questions about the child's symptoms. They want to know when the behaviors started, how they have changed over time, and how they impact daily routines. This helps the therapist identify patterns and possible causes. The therapist also looks at how well the child manages emotions, signs of mental health concerns, and strengths that can support growth. For younger children, the first session might involve only the parents sharing information. Older children or teenagers may join the conversation to give their perspective. The therapist uses this information to create a plan tailored to the child's needs. The goal is to improve emotional regulation, address mental health signs, and build resilience. This way, children can better handle stress and challenges in their lives. In practical terms, the presenting problem could be worries or fears that the child can't control, frequent tantrums, or trouble following rules. It might be social issues like feeling isolated or misunderstood. Developmental concerns such as speech delays can also be part of it. These problems often lead to difficulties at school, conflicts at home, or trouble in social settings. Understanding what the main concern is helps the therapist focus on strategies that teach children how to manage emotions, recognize early signs of mental health issues, and develop tools to bounce back from setbacks. It also helps parents know what to expect and how therapy can support their child's growth and happiness.